Hi guys, good morning, good afternoon, good evening. Welcome to this discussion of UPSC CMS for the subject of PSM. Yes guys, now let me make it very clear that the answers provided by the Honorable UPSC key might be different from what we are discussing over here, because I am taking the answers as per the NEET PG exam which you are going to give, or the INI CET exam. Okay, so don't worry for that. Again guys, the questions in PSM were awesome. If you ask me, I would love if UPSC starts preparing the PG entrance questions for the NEET PG, because they were really good, where they have actually tested all the important concepts of PSM. Now guys, as you know, UPSC is talking about PSM, but it looks into the PARK textbook. So there are around 5 to 6 questions which are given in PARK, but here at NAMS it is taught by our clinical faculties. So I would not be taking them as a discussion. I would just say that okay, this is for a subject, so I'm just sticking to my own subject, hardcore PSM. Yes guys, I hope you are ready. Let's see this. As an index of thermal comfort, the CET temperature is considered to be an improvement over effective temperature. Yes, it deals with which of the following? Now we know CET formula, TMH, temperature, M, mean radiant heat or movement of air. H stands for humidity. So answer to this question was 1, 2 and 3. So answer was option number C. This is also a NEET PG question. Last year in the NEET 2024, they had asked the device, it was an image based question which is used to measure the corrected effective temperature, and that was the Kata thermometer. So this year you might get a question in the NEET asking, okay, tell us what does the components of CET include as well. Yes guys. Now, in a child who has not received any dose of DPT and OPV, up to what age can the vaccines be given under the universal immunization schedule? Now guys, please remember, majority of vaccines under the national immunization schedule, the maximum age is 1 year. Now this brings me to a very important recent update. Japanese encephalitis, we have a new vaccine, the Kolar variant. It is now 2 years. Next we have OPV and MR, which is for 5 years. Next we have DPT, which is for 7 years. And next we have DT, where there is no cutoff at all. So answer to this question was DPT is for 7 years, OPV for 5 years. Answer to this question was option A. Again, a potential NEET question can come up from this. Now guys, a traveler who has passed through a yellow fever endemic zone and does not possess a certificate of vaccination against cholera enters a yellow fever receptive area, like probably India, because India is a yellow fever receptive area, because in India we do not have the yellow fever virus. All of you know this. Yes guys. So in India we have the environment, we have the vector, we have the host. The only thing which we do not have is the virus. So India is a yellow fever receptive area. For how long from the date of leaving the infected area must this traveler be placed on quarantine in a mosquito proof ward? Now guys, this person is apparently healthy and has not taken the vaccine. So this again comes from a modified NEET 2024 question, where they said that the period of quarantine is the maximum incubation period, which in case of yellow fever is 6 days. Now this works when there is no history of vaccine intake, when the person has not taken vaccine. At that time it is 6 days. But if the person would have taken vaccine, then the validity of the vaccine occurs from the 10th day. That's the reason, imagine the person comes on day 2. You have to keep the person for quarantine till the 10th day. So 10 minus 2, it will be 8 days. There are many students who ask me, sir, why is this differentiation done? If no vaccine, then only 6 days. But when the vaccine is given, then it goes up to 10 days. The very basic reason is because the moment you give a vaccine, there is change in the life cycle, which makes a huge difference to put the period as your 10 days. I hope I am clear with this. Guys, this is a very important concept. We should not be missing out. Again, probably NEET can ask the question this time. Under the ESI, standard question. Again, if you ask me, NEET is more than happy to ask questions on ESI. So if the sickness of an insured person is duly certified by the insurance medical officer, the periodical cash payment benefit is payable for a maximum period of how many days? So guys, it is a normal sickness benefit. So it is 91 days. All of you know, when we talk about sickness, we have a normal sickness which is for 91 days. Then there is extended sickness which is for the period of 2 years. This is for the list of 34 diseases, which includes the 29 notifiable diseases, all occupational cancer, all pneumoconiosis except bagasosis. Next we have enhanced sickness. In enhanced sickness, it is 7 days for vasectomy, 14 days for tubectomy. Now guys, in sickness, 70% of the salary is given, that is 30% salary is cut. In extended, 80% is given. In enhanced, 100% salary is given. That means not even a single penny of salary will be cut. Okay? Now this question is from your medicine about Wernicke's encephalopathy. So it will be covered in your medicine discussion. Okay? Now this, a housefly transmits an infectious agent by which of the following methods most commonly? Again, this is a micro question, and over here guys, you need to understand that the way a housefly carries is mechanical, because it is the body of the housefly or the vomitus which basically is responsible for spreading of disease. I have asked the answer about this to Surya sir. So if you have any queries, your dear micro faculty Surya sir will be more than happy to explain this particular question. Okay, no problem guys, looks fine. Okay, in the case of a 7-year-old school going child, which would be the most appropriate indicator to measure the current nutritional status? Now they are talking about the current. Now guys, birth weight cannot be a indicator for a 7-year-old child. Birth weight is generally important, maximum if you ask me, till the period of infancy. Mid-arm circumference, this works till the period of 5 years. Head circumference, again it is for newborn. So answer to this question is weight for height. So guys, at the Anganwadi in India, we take weight for age. But as you know, in clinical side, we read about wasting and stunting. So stunting is height for age, wasting is weight for height. But at Anganwadi, please be very clear, it is only weight for age. This is a very common confusion which students have in the exam. Consider the following statements about HBNC. Early detection and special care of preterm newborns is one of the major objectives of HBNC. Yes. ANM is the main person involved in delivery of HBNC. It is the ASHA worker. Supporting the family for adoption of healthy practices helps achieve the key objectives of HBNC. Yes. Now, interestingly, I got a message from one of the students asking that HBNC helps in adoption of children. I said, no. He said, sir, in UPSC it is given. Guys, please understand there is a huge difference between adoption of child and healthy practices. So guys, please read the option fully. Then only you will be able to do justice to a question. The primary aim of HBNC is to improve the newborn survival. Yes, answer to this question was option number C. Now the ASHA worker makes 7 visits under HBPNC. It is on day 3, day 1, day 3, day 7, day 14, day 21, day 28, day 42. Now guys, if it is a home delivery, you have 7 visits. If it is a hospital delivery, and we have a NVD 6 visit. If it is cesarean, it will be 5 visits. So guys, 6 visits because the day 1 will be skipped in NVD and cesarean day 1 and 3 will be skipped. Okay. Now, which of the following are transmitted as a sex link? This is pathology. Sanjeev sir will take care of. Inheritance, I am not getting into all this. Now, under which brand of the National AIDS Control provide the RTI STI service? It is the Suraksha Clinic. Guys, there is no Antara Clinic, no Chaya Clinic, no Sathi Clinic. Actually, Antara is the name of injectable DMPA. Chaya is the name of centrochroman. Now, the logo of Suraksha Clinic was our question in the last year FMGE exam. So, there is a red dot in the middle with a white plus and all the peripheries were marked as red. This was a FMG question. So guys, you can understand very clearly that at the end of the day, in the exam, you can surely get a question like this. Okay. Which one of the following is the major contributor of total energy intake in terms of energy provided in average Indian diet? Guys, you know, it is carbohydrate. Around 50% roughly comes from carbohydrate. And that's the reason if you want to go for a weight loss, just like Sachin sir, you should cut down on your carbohydrates. Stop eating dal, not dal, chawal and roti. Your weight will come down. So carbohydrates accounts for maximum of energy. Consider the following with regards to amino acid. Now again, I took the help from your biochemistry teacher. Essential amino acids are those that the body cannot synthesize and they must be obtained from dietary proteins. Yes. Non-essential amino acids, not just the essential amino acid, non-essential amino acids are also needed by the body for synthesis of tissue protein. Unless a protein contains all essential amino acids in amounts corresponding to human needs, a protein is said to be biologically incomplete. Yes. Animal proteins are rated superior to the vegetable proteins. So guys, essential amino acids are those that the body cannot synthesize and they must be obtained from dietary proteins. Yes. Animal proteins are superior to the vegetable proteins. Yes. Not just the essential amino acid, non-essential amino acids are also needed for the body for synthesis of tissue proteins. Yes. Unless a protein contains all essential amino acids in amount corresponding to the human needs, a protein would be considered biologically incomplete. So answer to this question was option number 4. Guys, again, please refer to biochemistry. They have taught you in detail. Sonam ma'am has taught you about the essential and non-essential amino acids. So please consult her if you have any queries with this. Yes. Which of the following strategies were encouraged by UNICEF under the GOBI FFF campaign? GOBI, growth monitoring. Yes, guys. O, oral dehydration. B, breastfeeding. I, immunization. So statement 1, 2 and 4 are correct. 1, 2, 4. Yes. Now guys, GOBI has been expanded to GOBI FFF. So G, growth monitoring. O, oral dehydration. B, breastfeeding. I, immunization. F, family planning. F, food supplements. And F, female education. Yes guys, done. So classical question. Again, this can be a NEET PG probable question. A question from ENT. Which of the following is the limit of daily exposure of noise that people can tolerate without substantial damage to hearing? It is 85 decibel. Deepak sir to help you out for details. How much illumination lux is recommended by Illuminating the Engineering Society for general office work? Now guys, general office work or your OPD, it is around 300 to 400. But where you are doing detailed work, like you are doing some kind of microscope work or you are a watchmaker, you would require more light. Even in the conference room, you need like a normal area, reception area, slightly darker. Corridors should have a diffuse kind of lighting. Dietary fibers are interesting. I also used to think dietary fiber have no metabolic effect, but I read that dietary fiber actually have catabolic effect. So because they break down the substances rather than building them up. Again, this is a biochemistry question. Yes, if you have any queries, Sonam ma'am will help you out with this. Egg proteins are considered to be the best among food proteins because of its biological value. Yes. Because of its digestibility. Yes. They contain all essential amino acids. Yes. their calorie content is higher than in protein of vegetable sources. No, eggs are not good source of calories. They are mainly talking about protein and fat. Answer to this question was option number B. Yes guys. Now again, this question is from radiology. Sumit sir will help you out. On a chest X radiograph, which of the following occupational diseases are most likely to be mistaken as TB? Answer to this question was silicosis. We know silicotuberculosis commonly are seen. With which variety of asbestos mesothelioma has been shown to have strong association? Guys, mesothelioma is seen with both amosite and crocidolite, but higher is related to crocidolite. So crocidolite is mainly related to mesothelioma. Under the Biomedical Waste Guidelines 2016, the human anatomical waste is to be carried in which color of plastic? Now, yellow color. If you want to recycle anything, we put it in red. If you want to put the sharp and the glassware, we put it in blue. If it is a general waste, we put it in black. Yes guys. Now, which of the following essential amino acids are usually the limiting amino acids in pulses? Again, biochemistry deck, none of mine. Yes, so it is methionine. So methionine is the limiting amino acid. In pulses, we have methionine, cysteine and tryptophan. Guys, please know what is the limiting amino acid in cereals. Please know what is the limiting amino acid in soybean. These are again common questions coming from this particular topic. Okay? Which of the following are defense mechanism? Psychiatry. I'm waiting for Sachin sir to give an explanation to it. So queries, go to Sachin sir, no problem. Now, what are the reasons for choosing coliform organisms as indicator of fecal pollution of water rather than waterborne pathogens? So you know guys, the most important is E. coli. If you get E. coli in drinking water, it means potty ka pani has mixed with drinking water. They are present in great abundance in human intestine and excreted in great number in feces. Yes, they have lower resistance to forces of natural purification. No, they are very good, and that's the reason guys, if you would have read the limitation of chlorination, you will know chlorination does not kill the spores. Yes, does not kill the spores. I hope I'm clear with it. Done. Now, they survive lesser than the pathogens. Yes guys, no, their survival is more. Okay? They are easily detected by the culture methods. Yes, answer to this question is option number A. I hope I'm clear with this guys. Now, the Ministry of Health and Family Welfare has launched a program to meet the challenge of high prevalence of anemia among the adolescent boys and girls. Consider the following in relation to the key intervention. Now guys, please try to understand, they are talking about WIPS. And when WIPS was launched, it was a blue color tablet with a 100 milligram tablet only. Guys, UPSC is still taking that. So they have taken the option 1 as correct. Yes guys. Whereas when you talk for NEET, we have already seen that now the goalies are coming at 60 milligram of iron. So there should be no confusion कि NEET में क्या mark करना है. NEET के लिए बहुत 60 ही है. ठीक है. These weekly iron and folic acid supplements are administered using a fixed day approach. Yes, it is given every Monday. It entitles the supervised administration of albendazole 400 milligram every 6 months. So we do deworming twice a year on the National Deworming Day. So guys, this National Deworming Day is celebrated on the 10th of February and the 10th of August. Now this year in the National Deworming Day, in certain places they had used even DEC, especially where the filaria burden is more. So we can use that National Deworming Day as a single time when we can give any form of this particular of deworming. Okay? Now guys, I hope all of you are a part of the Telegram group where we are having daily quizzes. If you are not there, please be a part. I will be more than happy. Yes guys, also you can follow my YouTube channel where we are having small short videos coming up, and also on Instagram. Coming to the question number 105. Now 105 actually is a very good question, and I expect this question to be seen in the next 1 or 2 years also in the other exams. The National Framework for Malaria Elimination in India 2060 to 2030 has defined certain milestones and target. Among the following, which is the specific target that has to be met by the year 2027? Now guys, if you look over here, all states and UTs must reduce the API to less than 1 case per 1000. This is true. All states and UTs must establish fully functional malaria surveillance to track, investigate and respond to each cases. This is also true. Entire country to have no indigenous cases and no deaths of malaria. This is also true. Entire country has to initiate the process of certification. This is also true. Actually, all 4 statements are true. But here they were talking specific of the year 2027. This is a very specific question. So guys, the program gives milestones. So we would not be bothered about the milestones which are gone. But the milestones which are upcoming is probably going to the question, and that's why they asked it. So by 2027, the indigenous transmission of malaria in India has to be interrupted. And by 2030, the re-establishment of local transmission has to be prevented, where malaria has been eliminated and the malaria-free status is maintained through the nation. So answer to this question was the indigenous transmission of malaria in India has to be interpreted. So guys, by 2027, answer to this question was option number 3. This guys can become a probable question in the NEET or the INI-CET exam as well. So please do not miss out on this awesome question. Okay? Now, under the Pradhan Mantri Suraksha Matritva Abhiyan PMSMA, the beneficiaries are being provided with a minimum package of antenatal care, including certain investigation and drugs on a fixed day approach. Which day it is? It is the 9th day of the month. So this is a color-coded program. If it is a normal pregnancy, it will be green in color. If it is a high-risk pregnancy, it is red in color. If it is PIH, it will be blue in color. If there is systemic disease, it is yellow in color. So depending upon the situation, we are giving the color coding. Okay? This pediatrics, Siddharth sir and Ashutosh sir will take care, not me, the senior Siddharth sir. Yes, I am the intermediate Siddharth sir. Yes, so small for dead baby, small for gestational age, and also the cutoff for your stillbirth rate. Yes, whatever they say, I will accept, because there is a confusion between 500 and 1000. Government of India says 1000. Okay, so we'll see. Now, core PSM. While performing the triage in response to disaster emergency, commonly a code internationally accepted 4 colors is used. Which among the following 4 color categories represents the highest priority for emergency response? Black, dead. This is the lowest. Green are the ambulatory people, the people who will be making the videos. Red is the most serious. So this gets highest priority. Yellow is intermediate. So answer to this question was red. INI-CET question B. This time in NEET also we are expecting this question on color coding. Consider the following statements with regard to the ice line refrigerator. These types of refrigerators are top opening. Let us look into this image. See, it is top opening. Koi doubt nahi hai. Based on the temperature zone, the ILRs can be divided into 3 parts. Now look into this image. Return vials, compressor, and this. So as such, if you see, they are not divided into 3 parts based on temperature zone. The image is there. So this slightly I'll put a query. The upper part of ILR is cooler compared to the lower part of the ILR. No guys, it is not the upper part. Upper part is not cooler. It is the lower part which is cooler. Yes, vaccine should never be kept in direct contact. Yes, answer to this question was D, option number 1 and 4. Yes guys, so answer to this question was D. I hope I'm clear with this. No doubt, because the lower part is cooler, and that's the reason at the lower part we keep OPV. This was the NEET 2024 question modification. Oh mere Bhagwan, teri daya permanent hame itni de. If you don't know the mnemonics, please open your workbook I have taught it to you. Which are the following indicators considered for computing the physical quality of a life index? Again a NEET 2024 question. Guys, I hope you understand UPSC and NEET are now going hand in hand. You never know, it is the same examiner setting it, and these are all there in your notes in your workbook. So you never know, the questions are coming probably from your workbook. Which are the following indicators considered for computing the physical quality of life index? PQL1, life expectancy at 1 year of age, literacy, infant mortality. So answer to this question was 1, 2, 3. Per capita income is a feature of HDI. So answer to this question was option number A, 1, 2, 3. Okay? Now, which one of the following terms is all or none phenomenon as best described as termination of all transmission of infection by extermination of the infectious agent? This is disease eradication. Pura hi zero ho gaya. There is only one disease in the world which is eradicated, smallpox. If you read from Wikipedia or WhatsApp University, they will write polio type 2 strain is eradicated. No, we do not talk about eradication strain wise. Yes, guys. Objectives are set forth for different units and subunits, each of which prepares its own action plan, usually on short-term basis. The definition best sums up which one of the following. Answer is MBO, management by objective. This is a classical UPSC question because in UPSC they want you to be managers. Guys, input-output analysis is quanti method of management. Work sampling is quanti method of management, whereas these two are quali methods of management. See guys, input-output analysis, we do read it in economics, especially cost utility, cost effective, cost benefit. Input is always money, output can be of different terms. So ये आपको पता है. You also know what is work sampling, where we quantify the amount of work. ठीक है? So two quantitative methods, it is there in your note. Management by objective. In this, each task is broken into छोटे components. So in MBO, we manage the performance of employees by setting objectives, and that's the reason, guys, it is called management by objectives. So small objectives are put up. Personal management, over here basically we look into development of the human personnel. So basically we groom the people. Okay? NEET does not ask quali methods. It is UPSC who loves to ask this. Panchayati Raj institution. Now guys, this was a question of Odisha Public Service Commission as well. I have given a detailed explanation of this also, so you can refer to that as well. So PRI system, again this is classical for UPSC, is at 3 levels. So we have a village, above a village we have a block, above a block we have a district. District in Hindi is called as Zila. So in the district we have ZP, Zila Parishad. In the block we have Panchayat Samiti. At the village we have Gram Sabha, Gram Panchayat, Nyay Panchayat. Answer to this question was option number C. Nyay means to give justice. So whatever is the rules and regulations in the village, if anyone breaks it, important people of the village sit and discuss. Gram Sabha is where the people sit and discuss and see how well the village will progress. Similar is for Gram Panchayat. Okay? Gram Panchayat is more of a elected body as compared to the Gram Sabha. Now guys, many patients with unexplained rash and fever were reported from a village close to PHC, which is the first step in investigation. Now here comes a slight confusion ki whether it is B or C. Now let me quote from the CDC, Center for Disease Control, and WHO investigation of outbreak. They say investigating the outbreak is the first step. Then we go for establishing the existence of the outbreak. So as per them, the answer is C. Guys, there might be some sources which might say B, but I am directly quoting you from CDC or WHO ka reference. So best answer, if you have to ask me to choose from B and C, will be C for cat. Now, John Snow discovery from cholera is a waterborne disease was an outcome of which type of study? This is directly from your note, natural experiment. If you would have seen, I have made you write, it is a quasi-experimental study and it is non-randomized clinical trial. Given below is a table showing diagnosis of MI. Yes, so the sensitivity is 45/50, 90%, and the specificity is 32,000 by 40,000. So 8 will go 4, 8 will go 5. So it is around 80%. Okay. So both statement 1 and 2 are correct. Okay. Data obtained from hospital records is not a representative sample of population. Yes, because in hospital you only have severe patients. So mild cases, subclinical cases miss out. Good. Population served by an hospital usually cannot be defined. Yes, AIMS may we get patients even from the four corners of our country. Cost of hospital care is not recorded, but that does not make the hospital record. So this does not seem to be fitting in right. Admission policy for cases can vary from hospital to hospital. Yes, answer is C to be the best option. In Apollo, you will have admission cases for dengue when the platelet count is 50,000. In AIMS, we are going for platelet only when we are having this, your 10,000 as the cutoff. I hope I am clear with this, guys. No problem. Absolutely clear. Done. Over. Finished. Now, ocular manifestation vitamin A. Saurav Sharma sir to answer. Sir has told me the answer is cirrhosis. For further details, sir will be helping you out. The bony deformity of pigeon tests in child, vitamin D. Tushar sir to answer. I am not getting into this. This, my dear students, was a quick video because I know NEET is upcoming. So I want you guys to quickly see rather than I giving you detailed ghanto explanations on this. If you still have any queries, please feel free to ping me on WhatsApp or on my email or Instagram. And I hope you are part of this Telegram quiz. Remember guys, UPSC exam is different from NEET PG. But this time the UPSC paper, especially in PSM, was very much resembling a NEET PG paper. That's the reason I would love if you quickly see this discussion. That's all from my side. Bye bye. See you. Love you all. Your host, your dost, PSM Sid.